Hi guys, Dr. Cliff here with HearingLoss.com, and in this video, I'm talking about the risks associated with untreated hearing loss. It is well documented that untreated hearing loss can lead to significant difficulties with communication. However, depending on the individual with hearing loss, this may not be enough of an incentive to actually seek out hearing treatment. But what most people are not aware of is that there are many more risks associated with untreated hearing loss than just not being able to communicate effectively. So let's cover some of the risks associated with untreated hearing loss, starting with unemployment and lower income. In a 2013 study published in the Hearing Journal, it was discovered that individuals with untreated hearing loss were 2.5 times more likely to be unemployed or underemployed than someone with no hearing loss. On top of that, it was identified that individuals with hearing loss earn 25% less than their normal hearing counterparts. Currently, it is unclear if treating hearing loss completely corrects for these numbers, but I would suspect that the gap would be closed significantly. A second risk to untreated hearing loss is cognitive decline and dementia. In a 2011 study out of Johns Hopkins by Dr. Frank Lin, he identified that individuals with mild untreated hearing loss were 2 times more likely to develop dementia. And if they had a moderate untreated hearing loss, this increased to 3 times more likely, and with a severe untreated hearing loss, this increased to 5 times more likely. Since then, there have been numerous studies linking untreated hearing loss to an increased risk of cognitive decline and dementia. Most notably was a study conducted by the Lancet Commission a few years ago, which indicated that hearing loss was the leading potentially modifiable risk factor for dementia later in life at 8% of total risk factors. A third risk to untreated hearing loss is an increased risk of falling. This increased risk was once again brought to light by Johns Hopkins, where they identified that individuals with even a mild level of hearing loss increased their risk of falling by 3 times. Shockingly, for every 10 decibel increase in hearing loss, this increased the risk of falling by another 40%. It is speculated that the reduced awareness to surroundings and the increased cognitive load due to an untreated hearing loss lead to this increased risk. A fourth risk is social isolation. In a 2020 systematic review of 2,495 studies published in the Journal of Otolaryngology, Head and Neck Surgery, it was identified that hearing loss led to an increased risk of loneliness and social isolation. This risk was even greater among women than it was among men with hearing loss. And since loneliness and social isolation are associated with a 29% and 26% increased likelihood of mortality respectively, this could be the scariest of all of these risk factors. Of course, more research is needed to determine how much treating your hearing loss would actually reduce your risk, but one thing I can guarantee is that there are no negatives to treating your hearing loss. If you would like to learn more about hearing loss and your hearing treatment options, make sure that you subscribe to the HearingLoss.com YouTube channel for more information.